Hi everyone, I've been getting some really great questions about pessaries in my office, and I figured I would share some of these common questions that I'm getting and the appropriate answers for them. So pessaries are typically a device that is used when an individual has prolapse. So prolapse can occur in different areas. So we can have prolapse where our bladder kind of falls into the vaginal canal. Our rectum pushes or falls into that vaginal canal. Our uterus falls down into that vaginal canal. This is typically when we're talking about a pessary, where that location of that pessary would be inserted into the vaginal canal. A pessary is a medical device that helps to support the connective tissue. So this is the tissue that we do not have voluntary control over. It's not like our muscles where we can contract and relax them. It's connective tissue, kind of like our skin. And so a pessary is designed to be able to provide support. You can think of it kind of like a tampon, or I like to think of it like a tent might fall down, right? And then we want to create more support on those walls so it stays upright. That's essentially what the pessary does. A pessary is not necessarily something that has to stay in the vaginal canal indefinitely. There are pessaries that can be placed and they would stay in the vaginal canal for a period of time, say 3 months, and then you might go to your provider where they might remove it, clean it, and reinsert it. This can be especially helpful for maybe people that are having trouble being able to reach, right? Whether they have arthritis in their hands or maybe they're just more elderly and so they don't have the same level of flexibility. But for those that do have a level of flexibility and can manage their own pessaries, there are definitely options where you can remove your own pessary. So if you want to do other activities that involve insertion, you're able to do that. Another question I get is, well, what kind of pessary? And the answer to that is it depends on you and your body. So you want to make sure that you are being fitted by a professional because there are different shapes and sizes of pessaries. So it's really important to find the right option that works for you and your body and your level of activity as well. Another aspect that is really important is how long do we use the pessaries? Of course, there can be some fluctuation person to person, but what we're starting to see in the research is that using a pessary for a more prolonged period of time has more benefit. So at least a 6 to 12 month period of time, if not lifetime, is going to be more beneficial. You're going to get better outcomes than if you use a pessary for a very short period of time, like 4 to 8 weeks, or even compared to a 3 to 6 month period of time. So a pessary is definitely something that we want to be using for a more prolonged period of time in order to have more optimal benefits. I hope this helps to clarify some common questions that I've been seeing in the clinic that you may also have been wondering yourself.